A lot of the treatment is determined by the age of the injury. So the younger you are when you dislocate your shoulder for the first time, in that sense quite similar to an ACL injury, the younger you are when you have the injury, the more likely it is that you will require surgery. So teenagers who dislocate will almost certainly continue to dislocate. And if there's any chance for you to get back to competitive sport, then probably early repair of any tearing or bony defect is required. The classic pathology in shoulder dislocators changes with age. So you need to realize very clearly that if you're a teenage dislocator, you will almost always dislocate out the front, and with the dislocation you'll have two classic radiological features. You'll have a Bankart lesion, which is an anterior inferior labral tear, sometimes a bony Bankart lesion, which is an anterior inferior glenoid bony defect, and you'll also have a Hill-Sachs lesion, which is typically apparent on an X-ray, which is a posterior superior humeral head impaction injury. As the head dislocates out the front, it gets wedged on the front of the glenoid, and you have that matching bony lesion. As you get older, however, the pattern changes. So in your 30s and 40s, sometimes you will pull off the greater tuberosity, and in your 60s, 70s and 80s, sometimes you'll pull off the whole rotator cuff. So be careful about your diagnosis. Treatment is typically arthroscopic repair for soft tissue lesions and a mini open repair for a bony lesion. And especially for contact athletes, a bony augmentation repair might be required rather than an attempted soft tissue repair, which will fail in some cases. If there is one thing that you need to watch out for, it's an axillary nerve palsy. So numbness over the deltoid, the regimental patch over the deltoid, and weakness on abduction needs to be very clearly documented with any dislocation. Well, typically young patients who dislocate in a traumatic fashion, or recurrent dislocators, or anyone with an axillary nerve palsy should be seen by an orthopedic surgeon.